Hi everyone, thanks very much for joining me today. Today we're going to be talking about BPA, so hormones gone haywire, and really why you should be considering BPA in your testing. So BPA, otherwise known as bisphenol A, and we're going to be looking at its role in hormonal or rather systemic dysregulation. We're really going to discuss how how BPA is so much more than just a bad plastic chemical, which we all know about in that context. It's biologically active, it's an endodisruptor, and it's interfering with multiple pathways in our bodies, especially the endocrine system. So we're going to explore and discuss how it affects our hormones, why it matters clinically, and how BPA testing can really improve your practice. So quick introduction to the team. If we haven't met, I'm Charlotte Hunter. I head up KBMO in the UK alongside our magnificent team. Some of them you'll have met and some on the webinar today, particularly Emily, who is going to be just checking in your questions. Alongside KBMO, I also run my own practice and I specialise in supporting women through their surgical menopause. So BPA is really complex. I think it's way more complex than the next 45 minutes could possibly do justice. And part of that problem is that it cuts across so many disciplines. So environmental health, toxicology, food science, nutrition, engineering, so many different disciplines. So what I'm going to do today is really pull out the main themes in the context of our work. So what is BPA, where is it found, and why does it matter, or why should it matter, I think, as well. So BPA is classified as an endodisrupting chemical. It's a diphenolic molecule derived from phenol and acetone, and its structure mimics estradiol, and that allows it to bind to estrogen receptors alpha and beta, and the membrane receptor GPER1. And because it's lipophilic, it can accumulate in adipose tissue and cell membranes, which really can prolong its biological activity. There are regulations around plastics and BPA, but there are lots of caveats and there isn't a full-scale ban. So, for example, you see that in UK food contact materials, BPA can be used, but only if the migration is at that stated level. And I don't know about you, but I always feel as though the ban on BPA in baby bottles, which was quite some time ago now, sort of lures us into this false sense of security. So there seems to be a lot of talk about what might happen with plastics, or looking at other countries and what they do. So we've got European standards and UK standards, and then standards overseas. There seems to be a lot of talk, but not so much action. And it's very easy to think, well, you just need to look at your desk and see the amount of plastic that we're using, whether it's, pens, pencils, literally everything. But we have this idea that if it's BPA free, it must be fine. Although I'm sure a lot of you are way more informed than that. But part of the problem is we are this plastic society, and BPA is an important chemical from a commercial perspective. It's an industrial component. It's commonly used in the synthesis of polycarbonate plastics, epoxy resins, and other polymer materials. And due to its mass production and widespread applications, the presence of BPA is ubiquitous in the environment. So land, sea, and air. And our awareness is growing more and more around plastics and the impact on our environment. But I think to appreciate why BPA testing matters in our practice, it's important to recognise just how embedded these compounds are in our everyday lives, our modern lives. And as I've said, BPA and its analogues are fundamental raw materials for manufacturing polycarbonate plastics and those epoxy resins which we've just talked about. The materials are used everywhere. So in food and drink packaging, in reusable containers, children's toys, thermal receipts, medical equipment, car parts, building materials, and even electrical component coatings. Even just looking around my desk, there are plenty of wires covered in plastic. And that's just the plastic that we see, all the other plastic that's in our homes, within the walls, I mean, I'm looking at my windows, everything is plastic. And because BPA isn't fully polymerized during its production, residual monomers can leach out over time, particularly when they're exposed to heat, acidity, or mechanical stress. And this means that BPA continually escapes into our environment. It contaminates our food, our water, even household dust. And humans are exposed through multiple routes. And I suppose, well, animals as well. Orally from food and drink, dermally from handling plastics, till receipts, and also inhaling airborne microplastics and dust. And there are loads of biomonitoring studies have now detected BPA in urine, blood, breast milk, saliva, sweat, hair, placenta, amniotic fluid, every bodily fluid, basically. And that's indicating that exposure is fairly universal and even potentially transgenerational. And that's quite scary, isn't it? Picking it up in things like amniotic fluid. And even the so-called BPA plastics frequently contain structural analogues such as BPS and BPF, which appear to have comparable endocrine-disrupting potential. So when we test BPA, we're really measuring the footprint of an entire chemical family that's become inseparable, certainly from our everyday lives and our experience of modern life. And the largest contributor is food and drink packaging. So polycarbonate bottles, storage containers, the epoxy linings of cans, they all contain residual BPA that can potentially leach into food and drinks or liquids, particularly when the plastic is heated, scratched, the contents are acidic or even oily. And even mild wear, like repeatedly washing your plastics in the dishwasher, can increase that leaching. So just think about those battered old Tupperware boxes that you have in the bottom of your cupboard that you can't find anything else, you just chuck something in it and you can see all the plastic is starting to degrade around the level that you usually fill to. Or I think you can see even more when you've had tomatoes or something in that and it's stained it and you can see the damage to the plastic. So yeah, chuck them out. Epoxy resins also line water pipes and are used in dental sealants, which is another direct exposure pathway. And the one you probably all know about are the thermal paper receipts, which are a major dermal source of BPA. And they contain free BPA, so it's not bound within a polymer matrix, so it transfers quickly through the skin, especially with moisture or if you've got hand creams or repeated handling. So occupational exposure is really high in retail staff and healthcare workers as well. And beyond the direct contact, BPA, as I've mentioned, is also present in indoor dust and airborne microplastics. And these particles absorb BPA, which can be inhaled or ingested, which can explain how they can be measured in urinary BPA, even in individuals who are avoiding plastics. They're really conscientious about ensuring their home has minimal plastics, food coverings, all of those things. But when they're out and about shopping, guess what? You're touching those receipts. Environmentally, BPA is also now detectable in soil, sediments, surface waters, and this reflects the global contamination from plastic waste and industrial effluent. We've had biomonitoring, which confirms how pervasive the exposure has become. 90% of samples in US and European studies contain detectable BPA. And that's not only in the urine, as we've said, it's found in serum, breast milk, amniotic fluid, placental tissue. So for us practitioners, this ubiquity means that we're not just dealing with isolated exposure events, but it's this chronic background of BPA load, plastic load, that may exacerbate hormonal or metabolic vulnerabilities. And I shared this diagram with you because I think it really sums up quite nicely what we've been talking about from, the exposures of BPA. So packaging, bottles, lunch boxes, water tanks, pipes, utensils, and then we have the effect on the land, the knock-on effect on our whole ecosystem. We have which involves soil, water, so food that we eat, fish that we eat, and then some of these non-dietary sources as well, or non-dietary contamination sources from packaging. So electronic equipment, paints, thermal papers in receipts, fire retardants, medical equipment, sports equipment, printing inks. And I think as well, it's interesting as well how now that COVID's been and gone, we went through that phase where we were using plastics and disposables even more. So a really great diagram. The reference is there if you want to have a look at the article. It's quite a good one. Oops. So we're mostly nutritionists, NTs, functional medicine practitioners, so food is what we do. So I just want to spend a little bit of time talking about the migration of BPA from packaging to our food. And this migration isn't a simple leakage event. As I said, we're not getting these one-off exposures. It's this noise in the background. It's complex, it's physiochemical, and it's influenced by multiple variables. First, the composition of the food matters. BPA is lipophilic, so fat-rich foods like soups, meats, dairy, oils will enhance the solubility and facilitate that migration from the polymer matrix. Also, the contact time between food and packaging is another really important factor. The concentration of BPA that migrates increases in proportion to the contact time, meaning that even a short-term storage may contribute. But longer storage or a longer shelf life means that accumulation is probably going to be more as well. Temperature is also incredibly important. It's a really influential variable. So in plastics, or those epoxy linings are heated, as in boiling water, hot filling, microwaving, that BPA release can accelerate dramatically. And some of the studies that we've seen have shown that at high temperatures, BPA migration can be up to 55 times higher than at 20 degrees. So if it's boiling or very, very hot. So this explains why hot liquids stored in polycarbonate bottles show significantly higher BPA contents. I suppose, thinking in a practical sense, people who are eating a lot of food out of plastic containers, microwavable food, pot noodles, for example, or, the posh ones that you can buy as well, they're still in plastic containers or have those linings in them. Another contributor is incomplete polymerization during manufacture. So residual BPA monomers remain trapped within epoxy or PVC coatings that are used to prevent can corrosion. And that's gradually released, especially during high temperature processing or longer term storage. And dietary studies have confirmed that canned foods are by far the dominant dietary source. So in one large analysis of, I think it was 204, about that anyway, food samples, BPA was found in 73% of canned foods compared to only 7% of non-canned foods. So there's a big difference there. In infants, toddlers, BPA levels were lowest in those who were breastfed or used non-polycarbonate bottles, and highest in those who were using those containers, particularly when formula or milk was warmed or heated. So, again, it's the idea of if you're formula feeding your baby, and you're putting boiling hot water in those plastic bottles to mix up the milk, even though that's a BPA-free bottle, it doesn't mean that, there are no analogues present or derivatives of BPA. And I think the takeaway for us from this slide or this subject talking about the migration is exposure intensity is highly dependent on how and where the food is stored and prepared. So heating plastics, storing fatty foods in plastic or canned packaging, and long-term contact of our food with that packaging raises the BPA load or potential, and that may show up in BPA testing. So there's another just summary diagram for you there, and again, I'll pop the reference there so you can have a look at that. So after absorption, BPA is quickly metabolized in the liver and gut, where it's joined to glucuronic acid or sulfate to form BPA glucuronidase and BPA sulfate. These conjugates, they're water soluble and excreted in the urine within a few hours, which gives BPA a relatively short half-life. However, enzymes like beta-glucuronidase, found in tissues and gut bacteria, can split these conjugates apart, releasing the free BPA back into circulation. So this is sort of similar to how we talk about estrogen, isn't it? You know, it's releasing that structure and it's just back into circulation again. So we're not getting rid of it as effectively as we should. So I suppose a thought for you to park is, where does gut testing, gut support fit into this whole picture? Because BPA is fat soluble, which we've mentioned, it can accumulate in adipose tissue, which it's slowly leaching back into the bloodstream. So, you know, it's been measured in adipose, it's been measured in liver tissue, brain tissue, breast milk. And this, again, confirms this widespread distribution of BPA. The conjugated forms are largely inactive at nuclear estrogen receptors, but they may still trigger rapid membrane-mediated effects. And for testing, the most reliable measurement is total urinary BPA, and that's the sum of free and conjugated forms of BPA. And that best reflects exposure and also our detox efficiency. And interesting is some studies still detect small amounts of free BPA in the blood, suggesting continuous low-level release from tissue stores or incomplete metabolism. So when we're talking about anything toxic, you know, whether we're looking at toxic and essential elements, we're looking at estrogen and now BPA, it's always about the exposure versus the metabolism and the excretion. And I've summarized this in a little diagram here for you. I mean, this is showing absorption, conjugation, excretion, and then partial reactivation if those bonds are broken down. And I think this diagram probably should have been a circular diagram rather than a sort of stepwise presentation. But you know, hopefully you get the gist anyway. So in a lot of animal models and studies, BPA has reportedly caused many, many critical health conditions. We've also got several human-based epidemiological and observational studies which show similar findings to this exposure. And I'm not going to spend the remainder of this talk wading through papers telling you where BPA has been found and the health consequence, or you know, pull that apart. We'll literally be here all day. There are so many things to consider. So I've just pulled out a few examples, starting with endocrine disruption. So the endocrine system is one of the body's most finely synchronized and finely tuned control networks, which regulate everything in our bodies, from reproduction, metabolism, to stress response, and even our mood. And BPA is classified as an endocrine-disrupting chemical, which means that it can interfere with the system at multiple points. So we have hormone synthesis, secretion, transport, receptor binding, and feedback regulation. And one of BPA's key actions is displacement. So it can compete with endogenous hormones for transport proteins, altering the ratio of free to bound hormones in plasma and effectively distorting the body's hormonal set point. And it also, at the pituitary level, BPA can block estrogen from binding to its receptors. This blunts negative feedback and can result in elevated FSH and LH, so follicle stimulating hormone and luteinizing hormone, creating reproductive disturbances that can resemble conditions like polycystic ovarian syndrome. BPA also acts as an anti-androgen, so it can bind to androgen and glucocorticoid receptors and reducing circulating testosterone levels in men. So it really is an endocrine hand grenade. You know, it's doing so, or potentially doing so many damaging things. BPA also affects the thyroid axis by inhibiting T3-dependent gene transcription through thyroid receptor interference. And that's a mechanism that can contribute to contribute to symptoms of low thyroid activity. But I think we have to think beyond, the classical endocrine organs, because BPA also has neuroendocrine effects. And some of the data has shown reductions in DHEA, which has been linked to low mood regulation, sex-specific behavioral and cognitive changes, and suggesting a pathway to anxiety or even depression. But I think overall and collectively, these findings demonstrate that BPA doesn't just mimic estrogen. I think that's generally how we're often taught about BPA. It's also disrupting the entire hormonal orchestra, and it has downstream effects that span through reproduction, thyroid health, adrenal, neurological health, and pretty much every system in the body, as you'll see as we go through these next few slides. So we've established that BPA is an disruptor, and I think this diagram really does illustrate, how this is working, particularly in the systems that we've talked about. And again, that paper's has some really good diagrams in it. I've used it a few times in this talk. So we've looked at the endocrine system as a whole. The reproductive system is also vulnerable, or particularly vulnerable, I think, to endocrine disrupting chemicals. And BPA consistently emerges as one of the most potent examples that we see. Being structurally similar to estradiol, BPA interferes with sex hormone synthesis and feedback. We've sort of touched upon this already, thinking about the endocrine system as a whole. And it can produce measurable changes seen in our luteinizing hormone, our follicle stimulating hormone, estradiol, progesterone, and testosterone. And we can see from this diagram that BPA affects women's health, but also men's health. And I think certainly when I studied nutrition years and years and years ago, it was only ever really talked about in the context of women's health and estrogen. Of course, men have estrogen, but we also see changes to how men produce testosterone. In females, the BPA structure closely mimics estrogen. And as we've said, that allows it to bind to estrogen receptors and ultimately disturb the hypothalamic pituitary ovarian axis. Hope I got that in the right order. I think I did. And this causes estrogenic signaling and feedback disruption. So it's a disruptor, isn't it? And this can lead to ovulatory dysfunction. We've mentioned polycystic ovarian features. And also we see potentially a higher risk of things like endometriosis, miscarriage, delayed puberty, and even premature birth. And chronic exposure can also result in infertility. And, a lot of you I know using KPMO testing work in infertility or fertility. And we see altered follicular development and endometrial receptivity, especially in those cases where we're detecting high levels of BPA. In males, the BPA exposure interferes directly with the testes, as you can see in the diagram there. So it's inducing atrophy, promoting apoptosis of some of the cells and reducing testosterone synthesis overall. It affects the ability to make sperm. The count may be lower, the motility reduced, and overall the quality much lower. BPA may also suppress gonadotrophin releasing hormone and neuron activity. Again, compounding this idea of our balance being ordered, or hormones being balanced and ordered rather, and reducing our overall reproductive capacity. But overall, I think BPA is acting at multiple levels. So central, gonadal, and cellular. And this undoubtedly produces significant consequences for both male and female fertility. So, as we've said, it's this multi-level reproductive and endocrine disruptor, altering hormone production, affecting our receptor activity, and also impacting the tissue responsiveness in both sexes. So it's more than just women's health. I think that's the point I want to make. A bit of a waffly way of saying it, but that's sort of the point I'm trying to make here, that BPA is not just about women's health. And actually, hormone testing isn't just about women's health. All of the tests that we're running, you can run on men as well, and we should be running on our male clients. So today, this is just an overview of BPA. If you really want to geek out on the detail, this is quite an interesting paper about the endocrine disruptor bisphenol A and its analogues with human estrogen-related receptor gamma. So have a look at that. It's obviously that receptor is an important target for BPA, and this study is really seeking to understand how BPA interacts with that target. So BPA's estrogenic activity is central to the carcinogenic potential of the substance compound. It can promote cell proliferation in hormone-sensitive tissues, including the breast, uterus, ovary, prostate, and testes. And even though its binding to estrogen receptors is relatively weak, it can alter co-regulator interactions and gene expression, which is allowing low doses to trigger genomic effects that may promote tumour development. Obviously, this is a very simplified version of a horribly complicated subject, so I'm not going to spend a huge amount of time on this. But the carcinogenic activity also rests on how BPA interacts with estrogen receptors and how it interferes with DNA methylation and gene expression after entering the nucleus. So altered gene expression can lead to hypercell proliferation, which may lead potentially to cancer development, cell mutations, and changes at a cellular level. And then alongside the carcinogenic activity, we've also got the immunosuppressive action of BPA. And we've seen in the research that it does have clear immunomodulatory effects that can lean towards immune disruption rather than helping us to regulate our immune systems. It induces oxidative stress, mitochondrial injury, which can lead to apoptosis of immune cells and impaired function of both the innate and the adaptive immunity, especially when exposure is occurring at times of development. And if you think about this, this is also where our FIT test and gut barrier panel fits quite nicely, because using that test, we are measuring the effect of food, nutrition, diet on the innate and adaptive immune system. So BPA has got the potential to shift the T cell balance, so upregulating some of the pathways while suppressing T regulatory cells. And this may promote cytokine imbalance, which in turn increases the vulnerability to chronic inflammation and even autoimmunity. And these particular immune shifts have also been linked to the acceleration of type 1 diabetes and other autoimmune disorders, particularly in women. But I think we have to think of BPA's immune action as a dual mechanism. So we've got immunosuppressive at the cellular level, but also pro-inflammatory and autoimmune promoting in a systemic sense. So it's this blend of both sides. And I mentioned a few slides back that we couldn't possibly look at everything to do with BPA and effects on our health. I really just picked out the main ones, being endocrine, reproductive, carcinogenic, and immunosuppressive. But we also see effects of BPA in our neurological health, gastrointestinal, metabolic, cardiovascular, and some of these in this left-hand side under metabolic alterations, we've got obesity, fat tissue dysfunction, increased body mass, hyperglycemia, insulin resistance, type 2 diabetes, thyroid dysregulation, hypertension, and coronary heart disease. So it really is, like I said, a bit of a metabolic or systemic hand grenade. So thinking about testing BPA. So we offer the HIT test, which is the Hormone Insights Test, which is our name for the Advanced Urine Hormone Metabolites Test by ZRT. And in the HIT test, BPA is analysed as an additional biomarker alongside the rest of the report. So you see all the sex and adrenal hormones, the estrogen metabolism, hydroxylation, methylation, which we can have a look later on at what's included in the report. But BPA is that added marker, and it allows us to evaluate environmental and endogenous hormone activity in the same sample, so we can provide a much more comprehensive picture of endocrine load. Because BPA is water soluble and excreted rapidly, the results reflect fairly recent exposure. So we're using high sensitivity testing for accurate quantification of those levels. Before analysis, the conjugated BPA forms, so that's mainly BPA glucuronide, never say that, and BPA sulfate, and then hydrolyzed so we can measure total BPA. And then the results are creatinine normalized to account for the urine concentration differences, and then reported in micrograms of BPA per gram of creatinine. So you don't really need to know all that, it's just a bit of background, but it's just trying to put into context how we measure and why it's reliable. And you'll see BPA on the report as a single clear line showing your patient's creatinine adjusted value compared with population reference range taken from healthy adults. Green obviously indicates typical exposure, because actually, most of us will have some degree of exposure. The yellow suggests moderate elevation, and the red marks levels above the 95th percentile. Importantly, I think, is the test allows you to integrate BPA results in context. So it's alongside estrogen metabolites, adrenal markers, and detox indicators with the methoxy estrogen. And it's really given you a multi-dimensional view of hormone and environmental interactions. Now, it's only one marker, so you've got to keep that in perspective, but I think it's a really useful addition when we're looking at hormones. In an affordable way, we don't have to order multiple tests. And I think that's what we're really passionate about at KBMO. We want to provide tests that give you lots of data for your investment. So for example, the FIT test, you're getting all the food sensitivities, looking at IgG and C3D. You're also getting the gut barrier panel. So, it's a similar sort of thing. We want you to have that information at a good price point. And as I've said, BPA results work best when they're integrated with that data. And high BPA combined with, say, high estrogen may suggest that there is a higher estrogenic burden. And this often correlates with sluggish phase 2 detox. So we would be considering glucuronidation and sulfation efficiency And these are the same enzymic pathways that are clearing estrogens. And we'd be thinking about supporting these routes nutritionally through all the usual suspects. I mean, I don't need to go through this with you, but things like magnesium, B vitamins, and sulfur-containing compounds. And then we'd be thinking about retesting 8 to 12 weeks post-intervention. Now, we've got to acknowledge the elephant in the room. And you wouldn't believe how easy it was to find a picture of a plastic elephant. But of course, BPA isn't the only plastic-based endocrine disruptor. We've got analogues like BPS, BPF, and BPAF, and they're just as widespread in BPA-free materials. And they can also bind to estrogen, androgen, and thyroid receptors, and systemically through the body, just as strongly as BPA. So why test BPA? Well, simple. It's still the most validated and well-characterized bisphenol, and it can serve as a really good proxy for overall exposure. And in practice, BPA functions as a sentinel biomarker. So when BPA is high, it's a red flag that total bisphenol and endocrine disrupting chemicals are elevated. That burden is there. And I think monitoring BPA over time lets us as practitioners measure the impact of behavioural and nutritional interventions objectively. So we do have to acknowledge that, but let's not discount BPA because I think it's still incredibly important to look at. And as I've said, it's a really good proxy for overall exposure. So BPA in practice, what can we do? Well, I think there are certain life stages that are far more vulnerable to endocrine disruption. So during fetal and neonatal development, even preconceptual care, the hypothalamic pituitary axes are forming. Even trace BPA exposure can permanently alter receptor expression and feedback sensitivity, in those crucial time periods. And similar vulnerability exists in childhood, babies, toddlers, young children, puberty, or those times when hormones are recalibrating. So we might see that in perimenopause, when declining estrogen levels also increase, alter, and influence the sensitivity of those receptors. And because BPA acts at nanomolar concentrations and as a non-monotonic dose response, even low-level chronic exposure can trigger epigenetic reprogramming. And those effects will persist long after exposure stops and can raise lifetime risks for metabolic, reproductive, and even neurocognitive dysfunction. I mean, this is crazy stuff, isn't it? But the bottom line, I think, really is that BPA doesn't just mimic estrogen. It's disrupting the entire hormonal network in our bodies. So this is really just to recap. And BPA and hormones really matter. And we have to think about how BPA interferes with hormone synthesis, transport, displacing natural hormones from carrier proteins, and also changing the balance between free and bound fractions. At a pituitary level, BPA distorts feedback loops. It may alter the secretion of luteinizing hormone, follicle stimulating hormone, cortisol, and our thyroid hormones. It's also behaving as an antiandrogen and as thyroid antagonist, reducing testosterone activity and also potentially blocking T3-mediated transcription. And all of these effects can also extend to our neuroendocrine system, where BP influences our neurotransmitters in terms of how we make them, how they behave, and neurosteroids such as DHEA, which can contribute to mood and even cognitive changes. And thinking about the clients that I work with, women going through perimenopause and menopause, that's a really, really vulnerable time, which can also coincide with volatility in some of our systems. So what do you do about elevated BPA? I mean, this is the big question, isn't it? Well, when BPA is elevated, the interpretation is always dependent on the broader context. So our hormone metabolism, our detox capacity, our co-exposure to other disruptors, our gut barrier health, our inflammatory potential. Then it's really about those two pillars of intervention, which again, we talked about a while ago, whatever we're faced with, whether it's, toxic elements or BPA or hormones, it's about reducing the exposure and supporting the elimination pathways. Also think about retesting. We don't retest enough. Think about, it's a minimum 3 months, but possibly 6 months, maybe 9 months. And I think when you test is always dependent on the context of your client or patient. What is going on for them? And as confusing and as frustrating as it sounds, there's never a set answer because it always depends. But we should be retesting to confirm that the strategies that we've put in place are effectively reducing that BPA load. And that might not necessarily be particular interventions in terms of supplements or diet or medicines or whatever. It can be about helping those clients to manage their exposure, which is just as impactful when we're looking at toxic materials. So I have just dropped this in because I think it is relevant in relation to inflammation and gut barrier integrity. So ideally, I would always test this alongside the HIT test, but also there are other tests out there. And one that I'd love to draw your attention to is the microplastics test sold by Kenko Health. So if you're not with them, it might be worth registering, have a look at that test. It's really affordable, but it's a brilliant one to do alongside your Hormone Insights test if you're interested in this particular area, or if your client's result for BPA is off the chart. So please do have a look at that. And I've included this as well because this is showing the various nutritional products that have been evaluated for their potential in ameliorating again specific BPA-induced toxicity. Now, I'm not going to go through all of this. We're not a supplement company, and this isn't my area of expertise, but I have popped the reference there for you so you can read about this in a bit more detail. It is a really interesting paper, so please do have a look at it. But you'll recognise loads of these products. Up here we've got resveratrol, which comes up a lot, and a lot of antioxidants. So proanthocyanins, grape seeds, lycopene, quercetin. I mean, all the products that we're familiar with. So please do have a look at that. But alongside nutritional interventions, and I'm not going to go into food and in any great detail, but there are some really practical steps that you can take. So starting simply, don't microwave food in plastic. Even those strong, durable polycarbonate containers still can leach BPA as they age or where they're repeatedly heated. Not just in the microwave, but in the dishwasher. Be very mindful about how you're caring for those plastic items. Check the recycle codes on containers because those marked with code 3 or 7 may contain BPA in its analogues, even though it might be described as being BPA free. Reduce your canned foods where possible. They have the epoxy resin linings, and that's still a major exposure source, as we've talked about, short term but long term. Those cans of food that have been sitting in the back of your cupboard for 5 years. We just be mindful of that as well. For our storage, we should use glass, stainless steel, porcelain, and a lot of people say, well, I don't want to throw stuff out. I don't want to buy a whole load of new gear. But think of all the jars that we throw out or we don't use. They can be repurposed as storage containers. Make sure baby bottles and toddler cups are BPA free. It's kind of all use stainless steel, or it's difficult. You can't really give a 2-year-old a glass bottle. I know what mine would have done with a glass bottle, and it wouldn't have ended well. But try also think about how you handle receipts. Now you go into shops and say, do you want a receipt, or can we email one to you? So things are changing. In the supermarkets, you don't have to have a receipt. So just think about ways that you can reduce that exposure. And also think about natural detoxification and from our diet. So plenty of fiber, good hydration, colourful phytonutrient-rich foods. All of those are going to help with your detox and elimination, especially via glucuronidation and healthy bile flow. So all of these things you know how to do. You've been doing this forever with your clients, but just think about it from a slightly different angle. But one of the messages we should be sharing with our clients and patients is that really it's just the small daily swaps that are going to meaningfully lower our BPA exposure and burden. And those choices can have a measurable impact on our test results, our long-term health in relation to our exposure to BPA and plastics. So just to really wrap up today's session, the exposure to BPA is realistically almost unavoidable in our lives. As an estrogenic endocrine disruptor, it exerts multiple organ effects, from our reproductive system to metabolic dysregulation, and also to immune, carcinogenic, and neurological changes. Reducing exposure is probably the most practical and immediate intervention we can encourage, particularly in pregnant women and developing children. At present, there's no targeted or specific targeted therapy for BPA-induced toxicity, but emerging evidence is suggesting that there are certain natural compounds, including resveratrol, curcumin, lycopene, ginseng, green tea, polyphenols, that whole group of foods and herbs and spices and brightly coloured fruit and vegetables and plant foods. They may help to counteract BPA's effects by supporting antioxidants, anti-inflammatory and anti-apoptotic mechanisms. And also I think these findings around these targeted therapies highlight the potential therapeutic directions, but also the need for more clinical studies to determine the bioavailability, the optimal dosing, and how that is actually going to make an impact or a measurable impact in practice. Part of that is that all of these beautiful foods work synergistically, they work together, and that's often the beauty of them rather than individual compounds, and that's incredibly difficult to measure and monitor. But ultimately, the dual approach of exposure reduction and biological support really is probably our best defence at present. Meanwhile, hopefully the research will continue to explore some of these natural supports and pathways because, back to what we said at the beginning of the presentation, we are a plastic society and it's pretty unavoidable and inescapable. But really, BPA is just one piece of a much, much, much bigger puzzle. Despite decades of research, the variety of plastics now in circulation is mind-blowing. So BPA, BPS, BPF, BPAF, phthalates, PFAS, and dozens more. I feel like I'm making this up. I could literally shout any few letters at you and it could potentially be a plastic. But each of these plastics have slightly different chemistry, but many of them still share very similar endocrine disrupting potential. And it really just raises a very difficult question. Can any plastic be truly safe? Probably not entirely. But because they're now omnipresent in our food chain, our water, and even our own tissues. So the best we can do is stay informed. We can test strategically and help ourselves and our clients to minimize their loads wherever possible. So just circling back to the testing, as I said, we test BPA in the Hormone Insights Test, and it is an alternative to Dutch testing. As you know, I love Dutch. I've used it for many, many years, but I'm starting to look at hormone testing in a slightly different way. And in 2 weeks, I am going to be having a conversation with Dr. Shania Sieber and really talking about why, perhaps we don't go Dutch anymore. There is another way. We can look at some of the markers much more comprehensively. So, more markers means more insights. We have a comprehensive progesterone and androgen analysis. We're not just looking at your total progesterone by measuring alpha and beta pregnandiol. We're now looking at the metabolites. So ALOP, which is incredibly insightful, but a lot of the other metabolites as well alongside that. We haven't got any inaccurate diagrams which mislead the data and mislead the information and send us down the wrong rabbit holes. And overall, there's more clinical value and relevance. Now, we are running out of time, so I'm not going to go into any more detail about that, but I do hope you'll join us in a couple of weeks to really talk about it. We also have an upcoming case study today at 12. We have our weekly hormone help hour, so if you want to join that, I'm sure Emily can pop the joining link in the chat. It's just a very informal discussion around a set of results, very much like our case conversations for the FIT test, because we really want to help you understand the tests and become fluent in what the markers mean and how to support them, rather than you desperately needing a support call for every single test that you do, and sometimes having to wait 2 weeks to speak to someone. So we want this to be a collaborative effort so we can really support you in a efficient way, I think, as well as hopefully helpful and educational. So if you haven't signed up with us, you can register at our website. We're also on Instagram. But really, I just want to say thank you so much for joining me today. I hope that this session has been interesting, but hopefully more useful than interesting. And the information will help you interpret BPA results with more insight, more clarity, and allow you to connect those mechanisms and that understanding to your clinical practice. Because hopefully this testing and interpretation will guide your clients in a practical evidence-based way to avoid exposure, but also improve their detoxification. And remember, we can't eliminate plastics from our lives entirely, but I think understanding how they impact our biology means we can manage their impact more intelligently and hopefully reduce our overall exposure. So thank you very much, everyone, for listening. I have just popped a page of I haven't put everything in there, just some key references if you want to have a look. And thank you very much. But if we have any questions or chat, I'll have a quick scan through, but I will hang around in case you do have any more questions. I'll also put this page back here in case you need the details. So yes, you'll get the slides. This will be uploaded to our website, so you can watch it there again and you can find the slides. But I don't think we've got any questions, which is good because I'm not a toxicologist. But I really hope that's been helpful. So thanks so much, everyone, for joining me today. And if you do want to join our next session at 12, it would be great to see some of you there. Quick question from Wendy. Sorry I missed that, Wendy. The BPA test. So the BPA test is in the HIT test. So that's our Hormone Insights Test, which you can get from KBMO Diagnostics. The practitioner price of the test is $249, and we suggest you sell that at $299. So what we've tried to do is fit ourselves between the price of a Dutch Complete and a Dutch Plus. So we're competitive in that market, and it makes it, you know, more accessible, I think. The other test is a microplastics test, which you can get from Kenko. So any questions, please do email us at ukoffice@kbmodiagnostics.com, and you can find all of our other educational materials at kbmodiagnostics.co.uk, just to confuse you. We've got a series of 3 webinars by Dr. Shania Sieber on the HIT test, so explaining what the test is all about, but also looking at a case study of a perimenopausal patient. We've got a webinar on estrogen metabolism, an introduction to the HIT test, and of course all the information relating to the FIT test and the gut barrier panel as well. So lots to keep you busy.